To perform the anterior hip distraction using a band, you're going to need something stable like a rig and a 1-inch band. If your hips are really stiff, you can use a slightly larger band, but usually the 1-inch band is about enough. So what you're going to do is you'll have it securely anchored. I'm going to go ahead and step into this band. I'm going to kind of shimmy it up so it's all the way up my thigh, kind of just right underneath my butt. And I'm going to scooch back until I feel a pull. It doesn't have to be a super strong pull, but just enough of a pull. And in this lunge position, I'm going to try to get nice and tall through my core, and I'm going to squeeze this glute. As soon as I do that, I should feel a stretch in the front of my hip. If I still need a little bit more out of this, what I'm going to do is I'm going to keep this glute tight, and all I'm going to do is I'm going to just bend that knee forward and press it, and then come in and out of that. So I'll press forward, keeping that glute tight, and then press back, and press forward, and press back. Far too often, people will just let their back go and dive through. That actually ends up mobilizing your back. We don't want that. If you stay nice and upright, keep that glute tight, all that stretch is going to go to the front of that hip. So this is that forward direction. From here, if I keep that glute tight and push forward, and then I think about going side to side, I'm going to, and you can even reach over with your torso as well. You might feel this in a different part of your hip. So we do 10 or so forward, 10 or so side to side. And then from here, that last direction, we're going to squeeze that glute, press that knee forward. We're going to rotate away from that forward knee and back. And we'll do 10 in this direction. So that way, now we've mobilized that front part of the capsule and all 3 planes of motion.